day, everybody. My name is Siraaj and I work for one of the leading innovative healthcare companies in South Africa. And today, we're going to be discussing next-generation public-private partnerships, specifically around healthcare sustainability and answering the question, can you do good and make a financial return? In terms of the South African healthcare spend, the private sector spends about 112 billion rand on only 8.7 million people, whereas the public health spends 157 billion on 44 million people. While the two numbers may seem disproportionate, they're not exactly comparable. So in the private sector, medicines cost a little bit more. You have access, however, to healthcare providers a lot easier. In the state, they've got tender pricing, so they can access medication at a lot lower price. But unfortunately, there are longer queues and slightly fewer healthcare workers relative to the number of people they have to serve. But what's very important is that 157 billion is the full budget that the public health has to spend. Whereas the private sector number is actually just what they've spent, not what they've budgeted for. So I'll give you an example, immunizations. The best they can expect to do is get to about 10% used for immunizations. So 90% of that budget hasn't been spent. So that 112 billion is only what was spent, not what's available to spend. So how are we going to access that money? I focus on HIV, and that's sort of my area of specialty. So with regards to the South African landscape, there are 6.4 million people living with HIV in South Africa. 3 million of those are on antiretrovirals. We have the #1 HIV treatment program in the world, which is something that has been an achievement in the last few years, taking into account from where we've come from, where there was a little bit of HIV denialism. In terms of some of the challenges, the main challenges is still trying to address new infections. As you know, a lot of young pregnant women still are at risk of HIV, 1 in 3, in fact, in South Africa. Another challenge relates to the lower antiretroviral coverage. As you know, 6.4 million people with, only 3 million aren't. So less than 50% of the people are accessing the treatment at the moment. Who's going to pay for it? The financing gap, which is the main focus of this talk. So where's the money going to come from? As we know, South Africa's gross domestic product is not achieving the 5% that it needs year on year. We're sitting at about a 2%. So where's the tax base? Somebody's got to be able to come up with the financing of this. Cost of antiretrovirals. As you know, antiretrovirals is an expensive treatment. And unfortunately, with the high volume of patients we're on, it's going to drain a lot of the resources. And then there is a trend around international donors where there's a decrease in external funding. So those are some of the challenges that we have to address. Take into account that the government wants to move towards 4.6 million people by the end of 2016 to be on antiretrovirals. That's going to cost the government 10 billion rand just on antiretroviral therapy. So we're going to start looking at some of the public-private partnerships that have been developed to assist government in healthcare. The first was hospital infrastructure and renovations, where a lot of the private sector has built the hospitals, put in world-class systems, but the Department of Health is still responsible for maintaining it, staffing it, etc. So they're still responsible in the long run. Another example is where retail pharmacies distribute family planning, medication, immunizations on behalf of the government. So it's government stock just being funneled through a retail pharmacy just for access. And then the other example is chronic delivery through a private courier company. So it's still the state stock, and they are paying a courier pharmacy to deliver this medication for state chronic patients. And so unfortunately, there's this unequal share of the burden. Even though it's called public-private partnerships, the majority of the cost is still on the Department of Health side. And I think we need to understand that it's not going to be sustainable in the long run. So unfortunately, I call this a spoiler alert, so it's not going to get any better in terms of the news that's to follow. So as we know, a lot of people think that in the private sector, CSI, corporate social investment, is the opportunity to be able to access private sector funding. Unfortunately, it's normally projectized money, so it doesn't have a sort of a maintenance or sustainability behind it. In 2013, about 8 billion rand was spent by private companies as part of CSI. The majority was through the mining, finance, and retail sector. And we can see that there's a trend from about 2008 down to 2013 that more money is being spent on education and less money is being spent on healthcare. And if you're an NGO looking at this, that might be a little bit concerning. As you know, we've come from a place where there were fewer people on antiretrovirals, but we've increased the number significantly. And as you can see, the data shows that doesn't show any plateauing. It's just going to keep growing. So how are we going to pay for all of this? So the National Strategic Plan, which is part of the healthcare budget focusing on HIV and TB, forecasts that in the financial year of 2016-2017, we need to have 45 billion rand to be able to manage the program. The government has only budgeted for about 22 billion in 2016-2017. And as you can see, the international donors are decreasing their funding. So we want to have more people on treatment, but unfortunately the financial resources within the public sector is strained, and the international donors are moving away from treatment programs more towards community strengthening programs. So as an NGO or an NPO, where do you go? If the international donors are leaving, are you expecting the government to take over that cost and maintain you and sustain you? But as you can see in the illustration of the fat cat versus the thin cat, the government is struggling in terms of the budget, and the private sector is sitting there with resources available to spend, but the NGOs and the NPOs are not sure how to engage with the private sector. So what a lot of the international donors have started to do is set up something called a social impact investment, which is made into companies and organizations with the intention of generating measurable, beneficial, and environmental impact alongside a financial return. So it's a concept that's quite challenging for a lot of NGOs because it's talking about sort of social investment and social impact, but alongside a capital financial return model. And those two don't normally sit well together. So I'm going to be giving you some examples of what we've been able to achieve. So the first one was basically engaging with government. We've signed an MOU with government to distribute HIV test kits. As you know, the most important component is diagnosis. So we developed a portal which allows the provider to capture the information. And this portal there was an incentive linked to this to encourage testing. As you can, this is the test kits that we distributed to the healthcare providers. And I think what's important about early detection and promoting testing is that what you want to see more people being diagnosed earlier. So from 2011, when the project started, you can see there's a significant improvement in the baseline CD4, which is your immune system. So the higher your CD4, the healthier you are. Even though you are infected with HIV, it's easier for us to manage you than having a person with advanced disease like AIDS. As you can see in the blue line, less people are being diagnosed with advanced disease subsequently. So there's a nice clinical impact to the promotion and the partnership we had of distributing the Department of Health test kits. The cost of the Department of Health was small in terms of the test kit, but the private sector insurance fund covered the cost of promoting screening. As you know, circumcision is been advocated by the World Health Organization. It's part of the Department of Health preventative program. Circumcision has been proven to reduce the risk of a man by 60% from acquiring the disease. So basically, no foreskin, lower risk of developing or acquiring HIV. So we partnered with a training organization called CHAPS, and they do surgical training. So we encouraged more GPs to come forward for training. You think a doctor would be able to do a circumcision because they're medically trained, but unfortunately it's a surgical technique, so you have to practice to be able to be competent. And the funding was made available to be able to train about 900 doctors throughout South Africa. And we've so far gone through various cities throughout the country to kind of make a national impact. In terms of the partnership with government, this was the first time that the government has actually endorsed a public-private partnership between a donor for the training and the private sector. The private sector was paying for the circumcision. So from that perspective, the Department of Health was just for the first time saying, this is great, I'm not paying for anything. But it's going to have a national impact in terms of increasing the number of people that have had circumcisions. And in terms of the actual impact in numbers, We also provided surgical packs. So the Department of Health also said, you know what, you're covering the majority of the cost. Thank you very much. We'd also like to encourage the doctors to use sterile new equipment. So the government's providing that. Again, small cost to the government, but the majority of the cost is covered through the private sector model. And I think it's important that people understand that we're focusing on high quality, safe procedures within the country. In terms of the numbers, historically, we've done about over 200,000 circumcisions. As you can see, in 2040, there was a nice spike up. The intention is to do 100,000 circumcisions a year. The government's target is 4.6 million circumcisions. They've done 2 million. We've done 200,000. In addition to that 2 million, and our intention is to constantly continue with this. I think what's important and what's unique is that once you have the skill of being able to do a circumcision for the community, it's there forever. So there's no end subject to the project ending. The doctor can continue offering the procedure. And I think that's a nice example of sustainable technical capacity building within a project. However, a lot of the circumcisions are still occurring in day clinics and in hospital, and only a few out of hospital. So we're trying to reverse this trend of saying more procedures should be done as out of hospital, because obviously there's associated costs such as facility fees. So now a male in South Africa wanting to be circumcised has more choice and more access points. So you can either go through traditional cultural, or you can go through the Department of Health, or can go to his GP. And I think that's just an important example of how we can make meaningful differences with regards to access and choice. The HSRC survey of 2012 found that in terms of patient behavior, there are fewer people using condoms during sex. So from 2008 to 2012, there was a significant decrease found by the survey of the number of people using condoms. In addition, more people are having sex with multiple partners. So this particular social trend with regards to sexual behavior is a concern, and therefore interventions such as HIV testing and circumcision has become important around prevention. Because I think we've inadvertently created this environment by promoting good news about HIV. You're not going to die anymore. Everything's going to be okay. And people sort of has decided that the risk is a lot lower than it used to be. So in terms of cervical cancer, another example where we've partnered with a non-governmental organization, Cancer, the South African Cancer Association, where they've gone to the banking community and they've basically offered cervical cancer screening. The banking insurance component has paid them for that service. So now we have a scenario where an NGO has a commercial revenue stream offering a service and being funded by the banking insurance. And I think those are the type of opportunities where we're focusing on preventative care and offering a service that is accessible through the insurance model now. And I think the banking sector has also sort of led the way around a lot of innovative preventative care interventions. Another opportunity that we saw was supporting the government around clinical decision support tools. We developed a guideline within Metropolitan. We digitized that using a company called the Open Medicines Project of South Africa, TOMSA, and Dr. Yasin Khan will speak in more detail about his app. Subsequently to digitizing our app, a few months later, the government put out a call for someone to digitize their guidelines. We were then successful in the application, and their guidelines were digitized within the app. Now we have one of the leading HIV decision support tools available in the world. The nice part is that the government did not contribute to this. We have pledged to maintain the app from an enhancement perspective as well. As you can see, the app was launched by the minister at the HIV conference to be able to share the information with healthcare workers throughout South Africa. Now, the impact that the private sector has had in the last few years is shown in terms of outcomes. So, does it make a difference? We've seen a decrease in mortality from 4.2% down to 0.6%. In terms of mother-to-child prevention, we've seen a decrease of positive babies from 4.9% down to 0.6%. That's a significant improvement in health outcomes and prevention. We are almost at zero. The UNAIDS targets is zero in terms of death associated with HIV and transmission. So I think we're getting really, really close. So in future, we see that potentially CSI could also sort of evolve into some type of social impact investment, potentially a developmental fund where you can access funding at a lower interest rate, as opposed to just doing the old model. And potentially, because of this huge shift towards education in CSI, maybe looking at linking education to healthcare behavior changes. And also in terms of other opportunities for NGOs and NPOs to offer preventative care services to be able to access private funding. And I think we want to also reiterate that it's complete, that healthcare can be sustainable by leveraging off the private sector infrastructure to benefit public health. So I think we've tried to address the question of, can you do good and make a profit? Or at least come up with some type of sustainable model of return. So I just want to play a clip of what we've been able to achieve.
Welcome back. Welcome back. The Health Department believes it's found a way to revolutionize HIV treatment in the country.
A new cell phone application has been launched on the sidelines of the 7th South African AIDS Conference. The HIV Clinical Guide app is a free mobile database for healthcare workers.
The fight against HIV has gone digital. In partnership with medical aid provider Metropolitan, the Health Department has launched a mobile app to assist clinicians with administering treatment.
We also know that we will not be able to rapidly expand the workforce. There is no way, and I've said this many times, we can be able to increase the number of professors, nurses on NIRMAT, other health workers. We can't. They can't increase at the pace at which treatment is needed. So given this, we have to find ways to make life easier for health workers.
And as a comprehensive mobile database, it seems it will do just that. Users can find pictures, drug dosages, and specialist information to deal with specific patients, from infants to adults. It's expected to be particularly handy in rural clinics. There's also a list of all public healthcare facilities for easy referrals. After the initial download, the app will not consume any data, except when the mapping facility is used. But the minister says the application cannot replace practical knowledge.
Only when you have got many patients, we have passed, we can rely on it. That will be my take. You know? Yes. Yes, they shouldn't be lazy.
The private-public partnership in the digital sphere is expected to grow.
More exciting developments will be launched in the next few months, and that will demonstrate the commitment of Metropolitan to partnering government. And we plan to do a TV app as well.
The software is now available for download on the Android and Apple app stores. Desan Thathia, Durban.
So just to end with, I think I'd like to acknowledge all the magnificent and innovative people that I've been able to work with. And I think we've shown that you definitely can make a difference in terms of healthcare sustainability, and that you can still do good and make a financial return. Thank you very much.